Hey, welcome to the video. I'd like to spend a few minutes talking about how we can treat snoring, fatigue, and sleep apnea without the need for CPAP or surgery with a simple, non-invasive, custom-fit dental appliance using our easy 3-step refresh sleep method. First, I'm going to tell you who this treatment plan is not for. This is not for people who do not value their overall health or their overall sleep quality. People who perceive they don't have a problem and don't care about the impact that poor sleep has on their quality of life. People who are morbidly obese, have uncontrolled cavities, or extensive dental treatment needs, the dental device may not be a good fit for you. Of course, if you're not sure, we would evaluate any of these physical limitations before ever starting treatment. Now, most importantly, we do not want to work with people who are not committed to bettering their health and overall sleep quality. I am committed to you 100% if you want to make the investment in your health and well-being, but we cannot help you if you do not want to help yourself. If you are someone who is not ready to make the journey towards better health and better sleep, then I'm going to invite you to leave now. Let's talk about who this treatment plan is for. If you've already been diagnosed with mild or moderate sleep apnea, the dental device are great first-line treatment and an excellent alternative to CPAP. If you have more severe sleep apnea, then this can still be a great option for you if you are unable or unwilling to use your CPAP machine. Dental devices are an effective, non-surgical treatment option for anyone struggling with CPAP. And if you are someone who wants to work collaboratively with your existing medical care team in order to enhance your overall care and health outcomes, then my office is a great fit. Most importantly, this is for you, someone who wants lasting, long-term results for their overall sleep quality and long-term health. So my big promise to you for watching this video is I will show you exactly how to fix your snoring and sleep apnea in order to maximize your sleep quality and help you avoid chronic disease in order to live a longer and healthier life. Now just imagine for a moment waking up and feeling like you actually got the rest you needed to feel ready to face the day. Or being able to sleep next to your partner without constantly disrupting their sleep because you're snoring so loud or tossing and turning to find a comfortable spot in order to breathe. Imagine how good your partner will feel getting a full night's rest because you did. I can help you create an environment where you could sleep next to each other uninterrupted and where you both can wake up feeling great and resentment-free. Or consider the mental clarity needed to focus on your daily tasks that you get from a full night's rest. There's no feelings of being in a constant state of brain fog. Just picture yourself waking up with actual energy, ready to get out of bed without feeling constantly exhausted all day, every day. Imagine if you had a way to take control of your nights so you could actually start to own your day and take back the life that poor sleep has stolen from you. Let me take a moment to show you a few of my patients who've had some amazing outcomes from dental appliances. This is Doug. He was waking up exhausted every day. His partner was complaining of snoring and he felt like he had no energy to play with his daughter. As a result of treatment, he feels like he's living life more fully and is able to be more present for his family. Because he wakes feeling more rested, he's had the energy to lose 22 pounds in 6 months. Heidi came to us at the recommendation of her dentist. She was unable to get insurance coverage in spite of her sleep apnea diagnosis, but she still chose to invest in her health. She was impressed with the simplicity of the entire process from start to finish. The appliance was comfortable to wear and easy to adapt to. Prior to therapy, she was waking every 2 to 3 hours. Now she's sleeping through the night, which she hasn't done in years. She felt great results on the very first night of using her appliance, and no adjustments were needed. Jessica was struggling to get used to her CPAP and was waking up every 2 hours to use the restroom. After starting treatment with a dental device, we did a follow-up sleep study, and it showed that her appliance has completely eliminated her sleep apnea, and she has since been able to return her CPAP machine. Now she's sleeping through the night silently next to her partner and waking up feeling more alert and focused. Now Rick is 76 years old, and he's worn an appliance for 10 years. His existing appliance wasn't fitting well, so his sleep apnea wasn't being effectively treated. He likes to routinely go on mission trips where there's no power for his CPAP, but he was too scared to travel with nothing. So my staff simplified the process to treatment and made it easy for him to restart therapy. We optimized his existing care plan, and now he has an appliance, is waking up with more zest, and feels like now if he naps, it's because he wants to, not because he has to. He's back out traveling to all the remote corners of the globe and is just thrilled with his outcomes. Now, there is no shortage of people we've helped break free from snoring. We've helped so many individuals just like you find an alternative to CPAP and get more restful sleep. They now sleep healthier and wake up feeling each day vibrant with more vitality in their life. And each of these people were just like you. How do they do it? Well, I want to show you how all of our patients were able to get these amazing outcomes. My office can provide a simple, mask-free, noise-free, cord-free solution for snoring and apnea management. And this is customized to your specific body and sleeping pattern. We will work collaboratively with your existing medical care team to provide individualized care, one-on-one time throughout the entire process. We can even provide sleep testing that's done in your own bed in order to diagnose the problem and help ensure great results. If something doesn't add up, we're there with you. If you're having any kind of issues, we're there with you. We're not like the big CPAP suppliers that give you a one-size-fits-all, cookie-cutter assembly line care with no support along the way. I'm going to show you exactly how this works, but first, let me tell you a little bit about myself. I'm Dr. Brenna McLean, a second-generation dentist from Northern Arizona. I'm passionate about providing tailor-made and innovative sleep solutions that give my patients an avenue towards better health and increased vitality. While most other dentists practice as a jack of all trades but master of none, my practice is exclusively focused on enhancing and transforming your sleep through dental appliance therapy. I've chosen to forgo providing other dental services and be the master of my craft so that I can be laser focused on providing exceptional outcomes in one arena. I love watching my patients have phenomenal results and seeing how a good night's rest can be truly life-changing. I've seen how sleep apnea impacts people across all ages, races, shapes, and sizes, from helping our service members inside the Pentagon all the way to my own bed, where my husband and I have both achieved better night's rests thanks to dental appliances. Now let's dive in and talk about how this process works for you. So I want to spend a little bit of time talking about the 3 steps that we walk you through my office to analyze you, customize you, and optimize your treatment. Okay. Now, in the first step of therapy, that's the analyze phase. So what that means is we want to make sure that we have a good diagnosis that tells us the understanding of what's going on with your sleep apnea. As we analyze you, what we're going to do is we're going to review your testing. If you've already had a sleep test done through your doctor's office, we'll make sure to go over that with you and discuss the results. Or if you have not gotten that done, my office will help facilitate that for you. That step is really important to let us know what's the severity of your sleep breathing problems and if dental device is an appropriate therapy option for you. So we have different ways we can do testing. Most commonly anymore, sleep testing is done in your home, which we've talked about in other videos. It's a relatively simple thing to do anymore, and my office will help coordinate that. Then after you've done testing, we're going to have you come into my office to do an exam. And what that exam is going to do is help us to customize therapy that's appropriate for you. Because if somebody has a diagnosis of sleep apnea, we really have 3 treatment options available. The 3 treatment options are CPAP therapy, dental device therapy, and surgical therapy. Now, there's pros and cons to each therapy, and it's really important that we pick the right path for you. One of the things I'd like to talk about is how dental device versus CPAP therapy works and the pros and cons to each of them. So the easiest way I like to think about CPAP therapy is if you can imagine on this, from your nose to your lungs is a balloon, okay? CPAP therapy effectively is going to be a mask that blows air into the tube and opens up and supports the entire airway system the whole way. So CPAP therapy is first-line therapy for sleep apnea because it is so effective. the whole airway is supported, and it does not matter where the blockage point is happening or how severe the problem is. It's going to work. The downfall with CPAP therapy is that people are not as compliant with it. It's a little bit more cumbersome to wear, and there's different side effects. People will tell me it's blowing in their eyes or their stomach, or they are feeling claustrophobic and they can't get comfortable with it. It's too noisy. So if you are not willing to put a CPAP on your face, it's not going to benefit you. Now, the way a dental device works is a little bit different, okay? Now, with the dental device, I like to imagine that in your airway, you have bone in your nose. So this part of the airway tube is supported. You have bone at your windpipe. So this part of the airway tube is supported. But the entire back of your throat is all floppy tissue that's not supported. So when you're sleeping and your muscles relax, your jaw can relax backwards. Partial blockage of the airway system would be snoring, right? Air is moving, but just not very effectively. Now, a full blockage in the airway system, that's apnea. That's what we're trying to treat based on your sleep study. So the dental device is working purely mechanically. It's similar to the head tilt chin thrust of CPR, if you're familiar with that. All we're doing is moving the jaw a little bit to create more room in the back of the airway, okay? So we're gonna create a brace on the teeth that's gonna prevent the jaw from falling backwards. In addition to, it has the ability to pull the jaw forward, okay? The back of the throat, the tongue, and the soft tissue back there is the most common site that the airway is blocking, which is why the dental device is so effective, but it is only able to manipulate one small section of the airway. So one of the biggest downfalls of the dental device is that unlike CPAP that's manipulating the whole system, dental device helps part of the system. So some people just don't respond as effectively or as fully to the dental device alone. And again, that's why we do an exam to try and identify any potential limitation that we may see that could prevent some of the success. Now, if you compare side by side CPAP versus dental device and how well they work, it's a little bit different, okay? CPAP is 100% effective and guaranteed, if it is on, to be treating your sleep apnea. However, about 50% of people are able to tolerate it through the night. The dental device, on the other hand, is about 70% as effective at managing the sleep apnea, but about 90% of people can wear it comfortably through the night. So it's a little bit of a kind of a teeter-totter of how well it works versus how well people are able to use it. And most commonly across the general community, the consensus in the medical community is that the overall impact to your quality of life and your health between the two therapies is about the same, right? There's something that works really well that you're not wearing as often versus something that doesn't work quite as well, but that you can wear more frequently. You're probably going to get similar health benefits with the both. Now, dental device does have some downfalls, okay? The downfall of the dental device is that it is custom made and custom built to your mouth. There are 150 different kinds of appliances available on the market. So it is my job to select an appliance that I think you're going to be able to tolerate, which is why our success rates are so high. But if you do not like it, you can't give it back because it won't benefit anybody but you. They are also designed to fit tightly on your teeth. If they are not tight, they are not as effective. And so that is something that we talk about in our follow-up phase and our kind of optimization phase, is that if there's any sort of discomfort or limitations that's preventing you from wearing it, typically I can correct and adjust that for you to improve your tolerance of it, but they are tight. Now, a lot of times people will tell me that they have, TMJ issues, jaw pain issues, so that they're not a successful candidate for a dental device. And I tend to disagree with that. I think that that should not be a barrier to starting therapy with the dental device. It just is kind of something that's going to guide us into appliance selection for you, because the we just need to allow the jaw to move comfortably based on your anatomy. Some people do experience some temporary, jaw muscle soreness or stiffness once they first get their appliance, but typically it resolves pretty quickly once we get them into the right spot with treatment. One of the last things that we would see as a potential side effect for the dental device is bite change. Now, I think that bite change is a preventable side effect if we're paying attention and if you follow the instructions that I provide to you. Okay, so there are two ways that your bite can shift. One would be more of an orthodontic type of movement where the teeth themselves are wanting to shift or drift. And the way that we can prevent that bite change from happening is, like I said, by making the appliance fit tightly on the teeth. That will prevent some of that movement. Additionally, we have some people that will have them wear retainers for a brief period of time during the day, and that can also be another layer of security to help prevent some of the bite change. But more commonly, what we would see with bite change is a more kind of full body movement of the jaw where people's teeth aren't wanting to line together in the back and they lose some of that connection of the back teeth. So the way that we can prevent that movement from happening is by doing some very simple exercises in the morning. And we also, as part of your therapy plan, make a little repositioning piece that you put in first thing when you wake up, and that will help to reset the bite to come backwards. So the bite change is a side effect that we can easily be monitoring for and preventing if you're paying attention to your body and the care plan. Outside of the side effects, people tend to do very, very well with the dental device, and a lot of the side effects are relatively short-lived, and I will help to kind of mitigate them if they do come up. Now, after we've built the appliance and put you into therapy, we're going to make sure that we kind of optimize your care plan to get you in the best spot as possible to get your sleep quality as improved as we can. If for any reason you are unsuccessful with the dental device or unsuccessful with a CPAP, then we would consider potential surgical therapy, which is the third treatment option for sleep apnea. And typically surgical sleep apnea management is completed by ear, nose, and throat doctors or oral surgeons. And my office could help shepherd you down that path if needed. Most of the time, people are very successfully managed with either a CPAP or a dental device or a combination of the two. And so my office will make sure that we answer any questions that you have throughout the process and do everything we can to optimize your care. Now you have a choice. I've given you the information on how you can have an alternative path outside of the standard CPAP route in order to start getting the refreshing sleep you deserve. And you have two choices in front of you, because if you're here with me right now, you probably aren't someone who does nothing. You're looking for a solution to a problem, and here are your options. Option one, you can go at it the old way, having to deal with the broken system that is not designed to help you get results. The old way, subjecting you to horrible sleep for both you and your partner. You're stuck in a vicious cycle of thinking you're sleeping enough at night, but it just never feels like enough. Or option two, we can work through a medically proven process with my team that actually advocates for you and your health. This way you can get restful and refreshing sleep so that you can actually get rid of the brain fog, stop disturbing your partner, and start to feel like you can get the sleep you deserve. After everything you've heard, I've decided to set aside about 8 hours this week for my team and I to speak with you on how we can help. Through the process of discovery, we'll get clarity on where you're at in the process starting from scratch. We want to know if you're brand new to sleep apnea, or if you've done this before, where you're at in the process, and what roadblocks you've already faced. This way, we can create a roadmap towards better sleep. If it makes sense to both you and to us, then we'll talk about the next steps. If you're interested in getting more freedom while you're sleeping and creating a more silent bedroom, then here's what I invite you to do. Book your discovery call now. Slots do fill up, and we can only accept what's available on the calendar. I want to be clear. Our job isn't to convince you. Our job is to ensure this is right for you. Or if not, we'll help guide you to the solution that is right. With that being said, if you want to start waking up, then the decision is easy. Why am I doing this? Because we practice a unique style of care called actually help people first. by helping you become more aware and educated on this process. If you want help and think it's a great fit, we'd love to see you in the chair and get fitted with a custom dental device to help you sleep more restoratively. We only accept people who are truly wanting to take the right step towards help with their snoring and sleep apnea. So what is the decision you have in front of you? It isn't to work with me or not to work with me. It's not even to book a discovery call. The decision is simply this. Do you want to continue dealing with feeling constantly lethargic and fatigued, never getting enough sleep, and having it negatively affect your life and your health? Or do you want to take control of your nights and start to actually own the day? If that's what you want, here's what to do right now. Go down below the video, click the button, and schedule your discovery call now. Fill out the information so we can get a better understanding of where you're at right now, and we can talk at the time you choose. Once again, my name is Dr. Brenda McLean. We look forward to helping you get the restful and refreshing sleep you deserve.